Hello, I am your host, Dr. Jack, and welcome back to the Medcastplus show. On the show, we feature local physicians and healthcare providers to educate us on various medical conditions and provide us with some very helpful tips. Today, we welcome Dr. David Stevens, the Chief of Ambulatory Care at New York City Health and Hospitals, Kings County. He is also a primary care physician with extensive experience in treating common chronic conditions, such as hypertension, high blood pressure, or diabetes and asthma. We will spend some time today discussing these common conditions and how New York City Health and Hospitals, Kings County is playing a role in helping the community stay healthy. Welcome to the show, Dr. Stevens. Really nice to have you.
Thank you.
Pleasure, and an honor to have you here with us, because some of the conditions we just talked about are seen in nearly every household. I think it's hard to find one of us who doesn't know somebody with high blood pressure or diabetes. Cholesterol is very common. And these conditions are important to our viewers today, so we're going to delve into them. But before that, tell us a little bit about yourself, where you're from, and how did you get where you are now?
Sure, thanks. Well, I was born in Brooklyn. I was born and grew up starting in Coney Island. Then I lived in Staten Island and finally went to high school in Long Island. Made it to all the big major islands of New York. And then I went to medical school. I went to medical school at NYU. And then I did my training at Johns Hopkins in general internal medicine. And since then, I've been back in New York. I've been working for the New York City Health and Hospital System ever since I got out of residency.
So a long time working with the healthcare system here in New York City.
Right.
And now you're here in Brooklyn, one of the largest cities, if it was its own city in America, and quite a bit of health problems here that New York City Health and Hospitals, Kings County, is working to help treat, fix, and keep our county healthy. Most of us look at a hospital as a place to go when we cut our finger, we fell down the steps, we're having chest pain. It's a place to run to when we're having an emergency. The ambulance takes us to the hospital. But not everybody looks at a hospital beyond that as a place to go to stay healthy. Even if you're feeling great today, riding your bike across the Brooklyn Bridge, no chest pain, going to the gym, you feel great. People don't realize the importance of getting preventative care. And so the hospital is not just a place to go to for emergencies, but there are parts of the hospital system that help people stay healthy so they don't need the ER, so they don't need an operation. Tell us a little bit about how Kings County is approaching this preventative care, primary care type opportunity for patients.
Yeah, well, Kings County's mission is to take care of its community, to ensure that our community gets the best care they need to stay the healthiest and to live the longest, best life possible. Sometimes that's in getting care in the emergency room, the heart attacks, accidents, sometimes that's surgery. But a lot of what we do to keep people healthy is to prevent illness. The two most important things that we do to keep people healthy and living longer and better are preventive care. That's things like vaccines, adopting healthy lifestyles, screening for cancer, and then there's chronic disease control. And as you mentioned, everybody you know has got something. And the statistics are that most people in their life will develop at least one chronic illness. Sometimes it's something common like hypertension or diabetes. Sometimes it's something more rare. But if we go after those chronic illnesses with our patients and we get them controlled, we can help our patients live feeling better, so they're not feeling the effects of these illnesses, and preventing the complications so they don't get the heart attacks and the strokes that come as complications of things like diabetes and hypertension.
And you mentioned a key phrase that patients in my own practice ask me all the time: how do I stay healthy? How do I stay, quote unquote, better? How do I live a healthy lifestyle longer? And so when you talk about preventing heart attacks, strokes, I mean, these are the things that are on most people's minds because, as you mentioned, it's hard to find someone in this country, in this county here in Brooklyn, who doesn't know a relative or a friend who had a heart attack or a stroke or cancer. And so being able to get ahead of these diseases is important. In the clinics, when they come to the doctor's office, we all know someone puts a blood pressure cuff on our arm and they check our blood pressure, they look in our eyes, they tap on our bones and our reflexes, and they feel our bellies. And while it may not take very long to do this, it's so important. When someone is 20 years old, 30 years old, and they feel fine, is this the time to start primary care, start seeing a doctor, or should they wait till a later age? When should someone now reach out and say, hey, I should go get a checkup with you?
Well, I think basically at all ages somebody should go for an annual checkup. There are things that they can be doing at every age to get themselves healthier. As you said, your patients come in and they say, what can I do to keep myself healthy? And even if you're feeling great, there may be things going on that the doctors can detect. You mentioned checking your blood pressure. That's something that we don't do for ourselves.
And can happen to rise at any age.
At any age, that's right. So getting screened for high blood pressure is important to do at least once a year. There are vaccines that people should be getting. Women should be getting pap tests starting at 18.
Right.
And mammograms starting at 40.
These are things that we're doing when we feel fine.
When we feel fine.
We're
That's
healthy,
right.
we're feeling well. And you mentioned, how do I live longer and live healthy? It's by seeing the doctor when you are doing well to maintain wellness.
That's right.
So let's touch a bit upon these chronic disorders. And that most of us, as you said, will get one. Blood pressure is a silent killer. We most of the time don't feel it. So for our viewers today who might be 20 years old and haven't had their blood pressure checked, or 30 years old and haven't had their cholesterol, haven't had their blood sugar checked, these diseases are often silent in the beginning. So let's start talking a bit about chronic diseases. What can we do for hypertension?
So hypertension, the first thing we can do for hypertension is a healthy lifestyle. A healthy lifestyle can prevent many of the cases of hypertension.
That's true, because I've had patients in practice where they developed hypertension. They took the healthy lifestyle tips that we offered, joining a gym, getting out in the park and running, riding the bike, and losing even just 10 or 15 pounds. They no longer needed the blood pressure pill. We stopped the blood pressure pill after however many months it was because they wanted to see what life was like now without it. And sure enough, slimmer, trimmer, more fit, no longer needed the blood pressure pill. So these are things for the folks watching today. This doesn't always have to involve a pill from a doctor.
Exactly.
Once someone develops high blood pressure, what are some of the risks? What are some of the bad side effects of hypertension that can occur if it goes untreated?
So the things we worry the most about with hypertension or high blood pressure, and we use those interchangeably, heart disease, heart attacks, heart failure, and strokes. Those are the when you talk about the silent killer, that's what's killing you. And many people will think of that they feel fine because they don't feel like they have high blood pressure. And that's what that silent killer phrase means. You don't feel anything. And often you don't feel anything until it's too late, until the heart attack comes or the stroke comes. So these are the number one killers in America still. And often they're preventable.
Right, and with some simple lifestyle changes, or just a pill a day or 2 pills a day,
Right.
you as an internist, a primary care physician, can treat this and can be treated at your hospital's outpatient facilities.
Correct.
Patients can go and seek care. Another big topic on everyone's minds is blood sugar. Is my sugar high? Do I have diabetes? How does someone know if they have diabetes, or is that also a silent type presentation?
It's almost always silent. Often, sometimes people will show up in the emergency room because they have symptoms of diabetes, but those are symptoms of very high blood sugar. So when your sugar is high enough, you will find that you're urinating more frequently. You may find that it's affecting your vision. But most people these days find out when they get a routine blood test, and they find out that their blood sugar is elevated.
And they're not going to know unless they come to the doctor's office.
That's right.
And so again, something that's silent most of the time, but can easily be detected in your office with a simple blood test.
Right.
You can find out in a day.
Right.
Once someone shows up to New York City Health and Hospital, Kings County Ambulatory Center, they see you or one of your physicians, and they're diagnosed with diabetes. What are the next steps?
What are the next steps? So in fact, it's a lot of the same steps that we talked about for high blood pressure. It's working on a diet, modest weight loss. Like, often people will think I gotta slim down to what I weighed at 16, and many of our patients will come in and they're 200, 220. A weight loss of 10 or 15 pounds really may make a huge difference, may reverse the diabetes. Obviously, we want to try and help them get to their ideal weight, but sometimes just a modest weight loss will make a big difference.
Simple exercise. Nothing, you don't have to be a
Simple
triathlete.
exercise.
You don't have to become a bikini model.
Right.
10, 15 pounds,
Right.
you could do in a couple of weeks.
You could, but it's hard. And I think that is one of the things that we're appreciating, that while we could reverse and control a lot of our chronic illness with diet and exercise, and it seems like a simple recommendation. Here's a pamphlet, don't eat this, don't eat that, go to the gym. It's hard to sustain. Gyms make their money on people who sign up when they're enthusiastic and then they don't show up after.
I find the same in the office when I'm seeing patients. Listen, as physicians, it's easy for us to roll off the tongue, diet and exercise, go to the gym. It's hard to do. I mean, even for us, working the long hours that we do as physicians, I know I miss the gym. I miss getting in there quite frequently. Yep. So we're also victims of the busy lifestyle that we have, especially here in New York. So it's easy for us to say, easy for us to tell patients, and we probably tell 20 patients a day the same advice. Right. But we want people to understand how important this is.
Right.
Getting into the gym, losing the weight, getting into a park and riding your bike, exercising can reverse blood pressure, can reverse diabetes sometimes.
Right.
But there are still people who are going to need medications. There are treatments that involve pills, and I think every day a new diabetes drug hits the TV channel commercials, correct?
Yes.
What are you doing at Kings County that is unique in the treatment of diabetes these days? What can our viewers expect to find that's new and innovative?
Right. Well, what's new is what's old in some ways, because while we do plenty with medications, with insulin, and there's long-acting insulins now that are only once a day. And there's, again, many new medications on the market now. We're also learning how to be smarter to help our patients adopt the lifestyles they need. How do they achieve the weight loss? And we're learning that patients who have struggled with their weight and with adopting healthy lifestyle for years, if we bring them in and they work together in a group of people just like them who've been struggling, they can give each other tips. They can say encouragement to each other, keep each other honest in ways that sometimes the doctor, I see them once every 3-4 months. I can't do that. But if they come in every week as a group and they work together on their diet, often they'll be able to meet their goals. I think so much of health is social. So much of what we do, it's easier to go to the gym if you're going with the gym buddy. Somebody's waiting for you there. You don't want to let them down. You don't mind letting yourself down some days, but you never want to let your buddy down. So I think we've learned a lot how to harness the power of social groups and letting people work together. On the medication front, an interesting area we're trying to move is that there's some emerging evidence that if we recognize diabetes really early in its course and we're very aggressive with the medication and we bring their blood sugars down to normal levels,